This afternoon, we're talking to our Department of Nursing in our departmental chat, and joining me is Dr. Kathy Cormier, our Department Chair of Nursing. Thank you for joining us, Dr. Cormier.
Thank you for having me. I'm pleased to be here.
Absolutely. Now, I know that nursing as a profession, it's always been important to a community, but especially in these times, I'm sure that nursing is even more vital to a community. Tell us a little bit about yourself and why you chose to go into nursing.
I have been in nursing. I hate to tell you how long because then you'll figure out how old I am, but I've been in nursing for close to 40 years. I was very lucky when I was in high school. I knew what I wanted to do. Got some very good guidance from my mother, who was also a nurse, and went right from high school to college. Finished up a 4-year program at St. Anselm's College in Manchester, New Hampshire, and then wanted to spread my wings a little bit. There was a nursing shortage in New Orleans, and long story short, they recruited me, and here I am.
Well, we're glad you are. So, tell us a little bit about LSUA's nursing department, some of the programs that you offer, um, and about accreditation, all those important things that students who are looking for a nursing program need to know.
LSUA has been a very strong force for producing nurses since the mid 60s when LSUA, we were one of the first programs actually at the college. We offer an associate degree in nursing, which upon successful completion of the program, the students are eligible to take the NCLEX or the licensure exam and then begin working as an RN. Most of our students have jobs before they even cross the stage to graduate. There's a nursing shortage right now in central Louisiana. And in response to that, we've actually worked with our community partners to increase our enrollment. So we were admitting twice a year, fall and spring, 60 students, and we are striving to increase that enrollment to 80 for each admission cycle. So we also offer a RN to BSN program, which is 100% online. And many of our ASN students transition to this program. I usually encourage students to take a little time off and take their NCLEX, get their feet on the ground with their new job. But I do encourage them to come back within 6 months. Many of them do. And I'm very proud to say we've made that transition very seamless. In fact, our seniors don't even have to reapply to the program. We only have to do is what we call a curriculum change and move them from ASN to BSN curriculum. And usually if a student's interested and we encourage it, we start telling them about the additional courses they need for the BSN when they come in to the ASN program. So if they're looking to pick up an extra course, we advise them to take something that counts for the BSN, and many of them finish within 12 months.
Wow. Wow. So if they get their associate's degree in 2.5 years and then they finish up their BSN in a year, they still have a semester left of TOPS eligibility. If
I have had one student do that,
that,
and she actually used a semester of TOPS for graduate school.
that is awesome.
Yeah,
That is awesome.
yeah.
So, and I've been doing this a little while too, a few years. So some of the questions that I get from high school students, there's just a misconception out there. And so if you could talk about that, I would appreciate it. A lot of students feel like you have to be a CNA before you're an LPN, before you're a registered nurse.
No, that's not true. What you do have to be is a good student. You have to study hard in high school, make good choices, because one of the criteria for admission is that students do have to have a background check from Louisiana State Board of Nursing. They are responsible for protecting the public, so they make sure that all students entering into a clinical nursing program are cleared by their investigators. Um, so my recommendations to high school students: study hard, do well, and make good decisions so that when you're ready to come into the nursing program, you meet those admission criteria.
And are there specific subjects that high school students should focus in while they're in high school, other than taking the curriculum required for admission to the university? If they had a choice, like which sciences they should take, what's a good, strong background for those high
A
school
good
students?
strong background would be chemistry. We do require chemistry. We do require 2 semesters of anatomy and physiology. And we also require microbiology in terms of science. So a strong science background in a high school curriculum would be very beneficial to students entering nursing. Math, we do require college algebra and statistics. So strong math background. And English, students want to know, why do I need to take English if I'm going to be a nurse? Because nurses need to know how to read and write. Documentation is a big part of our role as nurses in terms of documentation of patient care. So a strong English background, good writing skills will also be very beneficial to students entering the nursing program.
And of course, there may be some that are watching this that are curious about our transfer process. I know maybe they decided to go to school and have applied to clinicals, and that school that they're applying to has limited clinical space. What's the process for students who are transferring as far as clinicals is concerned?
If they have not started a nursing program, we use guidelines that are across all state institutions that tells us a course taken at LSUE, a course taken at ULL, transfer for this course at LSUA. So we, after students apply to the university and are accepted to the university, we do have a pre-nursing advisor. Our pre-nursing advisor specializes in advising nursing students. So they will be able to provide information about transfer credit. If they've already started a nursing program, nursing courses are not transferable just because every program is a little bit different. So there's really not an equivalence. Um, but many of the gen ed courses, if taken at other institutions, are transferable, and we provide that information to students when we do advising.
And it's important that those students are not able to go directly into clinicals transferring. Is that still the case?
That is correct. So if you're transferring from another institution, we have recently undergone a curriculum change and are now requiring a pre-nursing course. Transfer students are required to be currently enrolled at LSUA, so you cannot be enrolled in 2 schools at the same time, and have nursing as a declared major.
And talk to us a little bit about that curriculum change, the changes that you've made to the nursing curriculum this year.
So we have implemented what we call a concept-based curriculum. We have done this to promote student success in the nursing curriculum. The new curriculum helps students focus on major ideas instead of trying to memorize different disease processes and related nursing interventions. So we feel that this is going to help them be more successful within the curriculum, and also, most importantly, help them develop clinical judgment skills required for nursing practice.
Um, within the program, what type of training can the students expect to receive?
Every semester in clinical nursing courses, we have, in the new curriculum, we have a theory course, we have a clinical course, and we have a 1 hour pharmacology course. So in the clinical setting, usually in our first semester, we do get some hands-on in clinical sites, but the majority of that first semester is in skills lab here at LSUA on campus, focusing on health assessment, physical exam, how to take a blood pressure, a pulse, and also how to use PPE has become a household word now. So how to use that protective gear correctly, how to put it on, how to take it off, when to use it, and also med administration. After that first semester, we do extensive clinical experiences in acute care. Our two major clinical sites are St. Francis Cabrini Hospital and Rapides Regional Medical Center. Both of those acute care facilities have been extremely supportive of our nursing program, and many of our graduates end up being employed by those acute care agencies.
And I know that you guys have recently received quite a few grants from partnerships throughout the state of Louisiana. Can you talk to us a little bit about those? Congratulations, first off.
Yes, absolutely.
Talk to us about that and what you're going to use the funding for.
So we have a couple of grants that we have recently received. One is the Rapides Foundation grant, which actually that was started back in, was originally awarded in November of 17. That helps to fund our peer mentor program. So we have a program where we have our upper third and fourth semester students working with our first and second semester students. That has been very instrumental in helping students transition to the nursing curriculum. These upperclassmen students will work with students in first and second semester as they prepare for certain skills practicum, for example, how to do a head-to-toe assessment. And the first level students find it very beneficial. They're learning from someone else who's lived through it, and the upperclassmen have been very encouraging and very supportive of our first level students. So we feel like that is promoting a culture of caring among our students, and it has been very successful. We were able to get an extension for that grant, and that will continue through at least May of 2021. We also, due to the support of community partners, and in response to the nursing shortage in central Louisiana, we have a grant called CENLAW Nurses for the Future. And that grant is providing financial support for an additional faculty member to support that extra 20 students that are being admitted in the fall and spring, as well as $35,000 annually for nursing scholarships. And we just awarded our first round of scholarships this year. So we had 28 students receive a $1,000 scholarship that they were able to apply to summer and fall. And in fact, I have another call out for that right now because we have about $7,000 left that we want to offer to students coming into the fall semester. Because of that award, that grant, we were able to have what they call matching funds for Blue Cross Blue Shield Foundation award, and that we were awarded just recently, and our first payment will be in August. And that award is providing support for a full-time faculty member to serve in the role of student success coordinator. So ironically, we have tutors on campus for math, we have tutors on campus for biology, other areas, and none for nursing. So nursing is is a rigorous curriculum, and we want to provide additional support academically to our students, again, to help them be successful. So the student success coordinator, I'm very excited. Miss Martha McMillan will be serving in that role. Very young, creative, energetic. Students love her teaching style, and she'll be doing different workshops in different courses on content that's a little bit more difficult to help students, again, be academically successful, prepare We'll also focus on things like time management, how to study, how to take tests. Again, we're excited that Martha will be serving in that role. That Blue Cross Blue Shield Foundation award also includes another $45,000 in student scholarships. So we should be awarding that soon. We should be getting that award out soon for our students. So now those are scholarships that target clinical nursing students. So that's after they've been admitted to the program. So we're very excited about being able to provide that additional support financially to our students. Many of our students are non-traditional students and they're having to work, which interferes with their ability to study as much as they should be. So we're hoping that this financial support will help them focus more on their academics and less on having to work outside of the classroom.
And we have quite a few community donors who in the past have donated money for clinical students for scholarships.
Yes,
So I feel like the university is blessed with the donors that we've had
very blessed.
to really
Yeah.
support our nursing students. So absolutely. So talk to me a little bit about our faculty in nursing. You know, how they interact with students. What's the highs of our faculty that we have on campus?
Well, all of our faculty are master's prepared. So everyone has a master's degree in nursing. They come from a variety of clinical backgrounds, which is important because we need a variety of clinical backgrounds to match up with clinical experiences for students. So we have faculty that have expertise in labor and delivery. We have faculty with expertise in cardiovascular nursing, expertise in psych mental health. So we match the faculty's clinical background with the course that they will be teaching. Faculty, we do a lot of interactive learning with our students in the classroom because we feel that this is an important learning strategy to help them connect the dots, if you will, and develop those clinical judgments that they need to provide nursing care. Um, with COVID-19, things have changed a little bit, but I am so proud of our team, faculty team, because they have just really gone above and beyond to help students stay on track to graduate. So we have also used Zoom meetings such as this. So we are doing all of our coursework remotely. We're not 100% online in the ASN curriculum. If a student was scheduled to meet Monday and Wednesday, 8 to 10, we are still doing that. We are just doing it um, through Zoom. The university has come up with some new guidelines for the fall, and we have options to do remote, but also what they call hyperflex, which will allow for social distancing in the classroom. And half the students enrolled in the course will come, let's say, on a Monday, the other class will come on a Wednesday, and those that are not on campus that week will be attending remotely. So we've made several adjustments. We've also incorporated what we call virtual simulation. So students, it's a software that we use through our publisher, and it provides certain scenarios. The seniors in particular, well, everyone enjoyed it in the spring when we implemented it, but the seniors in particular commented that some of the scenarios provided them an opportunity to experience a clinical situation that they had not experienced in the hospital. So something that I would call a low frequency but a high risk. And so they were able to experience that virtually and develop the clinical skills that they needed, the knowledge and skills that they needed to deal with that particular situation.
Yeah, we're learning all kinds of new things with this COVID
Yes,
stuff,
yes, they
for
are.
sure. So I know that you guys are very close to your students. Talk to me a little bit about our graduates. Do you know what some of our graduates are doing? Is there anything you want to share that you're proud about?
Well, I'm always proud of all my
Yeah.
graduates. That's probably the best thing about my job. When I go to the hospital to make grounds, I see my graduates. Now they're a real nurse, and they love their jobs and are very excited about sharing what they're doing. They're all over. I mean, as I mentioned, the majority of our graduates work here in Central Louisiana at Christus St. Francis Cabrini Hospital, as well as Rapides, but also in other areas of the state. Many of them right out of school are hired on to work in ICU units, emergency room. We've had students go into NICU, neonatal ICU, OB, maternal child, telemetry, you name it. They get hired for those positions. We've had several students who have just gone all along ASN, RN to BSN, and then have gone to other universities in the state, and several have completed their nurse practitioner and are now working as what we would call advanced practice RNs. So very proud of our graduates, and we try to stay close with them. Many of them will email me, especially at this point when they first finish up. I passed my NCLEX. Thank you. And, we're very happy to get that good news. So,
Absolutely. And I want you to talk a little bit because when we give tours to students, we bring them up to the simulation lab, and it is a sight to see. So, can you tell our viewers a little bit about what's available and what our students get to experience in that simulation lab?
well, we have several labs here in the nursing building. Some of them are what we would call just your regular skills lab. We have one, two, three, four labs now because we've expanded that are available for students to practice IV start, their history and physicals, med administration, etc. And then we have one room that is what we would call high fidelity simulation. And these are mannequins that are able to speak. One of them delivers a baby. We've had students through our partnership with AHEC. Some of the local high school students have come on campus and they've experienced this directly. Um, they breathe. Students can take vital sign, blood pressure, pulse, can do an assessment on the mannequin. Faculty will program the mannequin for a specific scenario, and they have an opportunity to practice certain nursing skills in uh, on just a very user friendly, if you will, friendly learning environment where it's not high stakes being with the patient. So um, we use that quite frequently with our students, again, to help them with skills that they may not have had in the clinical setting.
Well, is there anything else you'd like to share with the audience that we haven't covered about your program?
Um, I do want to mention that in terms of NCLEX pass rates, we do have a strong NCLEX pass rate, usually over 90%, and that is typically above the national average. So I like to tell students that no matter what schools they're looking at, that is something you want to ask about. What is your NCLEX pass rate? And again, LSUA usually hovers above 90%, which is above the national average. The other important question students want to ask when they're looking at nursing programs is, are you accredited? And LSUA is accredited by ACEN, and that is very important for students to ask when they're looking at different nursing programs. Um, so I would just encourage you to contact us if you have any questions about the nursing program. We again have a pre-nursing advisor that specializes in advising just nursing students. So if you have any questions about the different tracks, we do also have an LPN to ASN track. So you had asked me the question, do you have to be a CNA and LPN? No, you do not. We have a program where you can come just in as an associate degree program. However, we do have a special track for LPN to ASN students, and we've recently made some changes in that track as well. We have a um, competency testing now that the LPNs will do during their pre-nursing course, and if they complete that successfully, then they can bypass that first semester entirely and finish up the ASN degree in 3 semesters. The other big change for the LPNs is that we no longer require 1 year's experience. So if a student is graduating from one of the VOTEC schools and they have a 2.7 GPA, they can come right into that pre-nursing course and begin apply for clinical. If they're accepted, they will be able to begin without the 1 year's clinical experience. That's a big change in our program that I want to share with the LPNs. They do, of course, would have to have passed their PN NCLEX, their licensure exam that they have for the practical nursing, but they do no longer need a full year's experience before they come into the program.
Dr. Cormier, thank you so much for taking time today to chat with us. And if you have any questions regarding the nursing program, feel free to reach out to us. You can email nursing@lsua.edu. If you have questions about admissions or financial aid, please reach out to us at admissions@lsua.edu. Thank you, Dr. Cormier.
Thank you.
Okay.
Good luck to everybody. Stay safe.